At Wake Forest, we have the most active research program in ALS in the state, and mostly because, not just based on the number of projects we're doing, but the breadth of studies that we do here, I think, is really what is really cool about our center right now, is that we're doing research at the very most basic levels where we're trying to understand the disease. We have another project that is geared at determining if there is a diagnostic test for ALS, which might help improve diagnosing people earlier so that we can start treatment earlier. And then we do traditional clinical trials as well. Then we also do very simple studies where people just take surveys, or we have questions about their quality of life and things like that that we've been involved with, that really anybody can do, even if they're quite sick from the disease at that point.
I decided to do because, you know, it's about the only thing you can do to help yourself is to participate in a drug trial like this, which involves a central line catheter placed right above my heart, and we do twice daily infusions of the studied drug. The second study was the muscle biopsy, where Dr. Karras was trying to look for the nerve cells to see when they start to become damaged. So he used a needle biopsy to take a piece of my muscle in my bicep, and then they looked at that under a microscope to see damage. And then the third study was the electrical impedance myography study, which basically was trying to measure muscle strength test using electronic device to measure resistance through a muscle.
It's a pretty complicated program. We usually will have 5 to 8 studies at any one time that people are involved with at different levels. So I'd say about a third of our patient group are involved in some kind of research study. One of our goals is to have some kind of clinical research effort for all of our patients. We think that's really important to provide hope to patients with ALS.
One of the roles that I participate in primarily is, as the nurse clinician, is to, once the patient has been diagnosed with ALS, then I'm the first link of contact for them. And my primary role is to make sure that they understand their diagnosis once the doctor has communicated that to them, and also to answer questions that come up afterwards. A lot of the times the patient, when they're given that diagnosis, are in shock, actually, to receive a diagnosis of ALS. And after a few days or a couple of weeks, they have a lot of questions about the disease process and the prognosis of that disease. And then what really do we offer here at the ALS Center for them? And at that time is when I really do a formal introduction to our clinic, which is a multidisciplinary clinic here at Wake Forest, where we offer a variety of therapists.
I come here also for the ALS clinic, which is basically all the therapists that an ALS patient might need to see basically gather here, so I can see them all in one day as opposed to having to come back multiple days or travel to different locations. So once every 3 or 4 months I come and I see a respiratory therapist, a physical therapist, an occupational therapist. There's a nutritionist, a psychologist, an adaptive technology consultant, I guess would be the term, social worker, a representative from the ALS Association to talk about if I need grants or anything they can do to help. Clinical trial visit is usually an hour or 2, and then depending on how many clinicians I see is 2, 3, 4 hours. And then I see Dr. Karras again, it's just for a physical exam.
At the clinic visit, there's lots of different things that they can do to help them have better quality of life, be more independent. That's one of our really important goals. The other important goal I mentioned earlier, which is to provide hope, which we see that as doing that through providing research opportunities.
I'm really glad what we are doing here makes just hope for these patients. I'm the one who performs the breathing testing or muscle strength testing and the survey that we are conducting regularly when they are in ALS study. What I'm doing is that I follow a patient through the whole visit and trial. Some studies may take about just 1 year or a few months, but some other studies, the only drug trial that we have right now, patients are in this study for 2 to 3 years. Eddie is one of our youngest patients here in ALS Center. I really admire his enthusiasm, his willingness, and his intelligence to willing to do research and not helping just himself but the other patients too. It's a pleasure to work with him.
The mechanisms that we've identified involved in ALS may occur fairly late in the disease. We know the disease is very much advanced by the time we make the diagnosis. And then on top of that, what we have to give people probably only affects them later in the course of the motor neuron death. We're very excited about the HSP, the heat shock protein project here. And one of the purposes of the muscle biopsy is to show that we can measure the connection between nerves and muscles and look at what's happening in ALS, because we think that's where HSP is going to be effective. So we're going to want to try to show that we can biopsy humans and measure connections at different stages of ALS. But the next step in that will be to look at the effects of HSP on those connections and decide if the drug is actually doing what we think it will be able to do. And that'll give us some idea of whether it's going to be effective in ALS, but will also give us some ideas of whether it's effective in other diseases that involve denervation, which are many, but include neuropathy and trauma, and just a lot of neurological diseases might potentially have benefit from this drug.
So for me, I guess the biggest thing is just trying to help out. I mean, I do have a lot of people helping me, and it takes ALS patients to get, the muscle biopsy data or the electrical impedance myography data. So I just feel that if I can do a little bit of helping out myself, that I don't know, it makes me feel good, or if it's just I feel like I'm doing my part.